Mr. Chairman and honorable members of the committee, thank you for the opportunity to testify today about the significant threats to religious liberty currently facing our country. My name is Jeanne Monahan. I work at the Family Research Council, a Christian public policy organization. We represent more than 1.5 million families of different denominations around the country. As you are aware, the Affordable Care Act requires health insurance to include preventive care services for women, and the administration chose to mandate all FDA-approved contraceptives in the list of covered services with a very narrow religious exemption that will essentially apply only to churches. I speak today as a representative of Americans, particularly women, who are opposed to this mandate. Fundamentally, we believe that the President's mandate violates religious liberty, undermines conscience protections currently in place, and profoundly discriminates against people of faith. Almost every Catholic bishop around the country has indicated that his diocese will not comply with the mandate, but this is not simply a Catholic issue. Over 2,500 evangelical church leaders recently signed a letter in opposition to the President. The National Association of Evangelicals, the Southern Baptist Convention, the Jewish Orthodox Union, and other national religious groups have also formally voiced their opposition. Religious women are also speaking out. In a recent letter signed by thousands of women of 18 different faiths, including doctors, lawyers, business owners, and scholars, women wrote, in quotes, "No one speaks for all women on these issues. Those who purport to do so are simply attempting to deflect attention from the serious religious liberty issues at stake," unquote. This is about religious liberty. And yet, I would also like to provide context about why people like me would object to this mandate. Drugs and devices that can destroy rather than prevent life are included in this mandate. It is a scientifically valid belief that pregnancy begins at conception or fertilization and not at implantation 7 to 10 days later. But certain drugs and devices are included in this mandate that prevent implantation, and one drug included can work post-implantation. Emergency contraceptives are included. Plan B can prevent an embryo from implanting. One extensive literature review of Plan B revealed that it possesses at least 7 modes of action preventing implantation. And then there's Ella. Last year, the Food and Drug Administration approved Ella as an emergency contraceptive, but it is chemically and functionally almost identical to the FDA-approved abortifacient RU-486. Ella can cause the demise of an embryo post-implantation. In a study of macaque monkeys, Ella aborted 4 out of 5 fetuses, and there are a number of other studies that are included in my written testimony. Many Americans believe that drugs that destroy embryos are wrong regardless of FDA classification. Many Americans are profoundly troubled by the inclusion of these drugs in this mandate. These Americans should not be forced to participate in and cooperate with their coverage and insurance plans. The HHS contraceptive mandate violates long-standing federal conscience and religious protections. Even many women who are favorable towards contraception oppose this mandate. Recently in the San Francisco Chronicle, a columnist wrote, quote, "As a believer in family planning, I suppose I should be thrilled, except that President Obama just trampled on the first part of the First Amendment. In a raw exercise of power, the Obama administration has decreed that religious organizations must reject their deeply held beliefs and hand out FDA-approved contraceptives, including the morning after pill. Now it turns out Americans of all religious persuasions are free to choose, as long as they choose to agree with Obama," unquote. It has been said, you can be sincere and sincerely wrong. We don't question the President's motives, but we think he is sincerely wrong. You might disagree with me and think that I and thousands of women like me are sincerely wrong. Fine. But don't force us to don't discriminate against us and don't force us to violate our consciences. We strongly urge you not to allow this President to discriminate against those with moral or religious objections to this mandate coverage of contraceptives, sterilization, and abortifacients. Thank you.
Ms. Monahan, and I was amazed earlier too about the conversation, because you are here to testify on what actually is what I believe, and I think you believe, an assault on our religious freedoms, our religious liberties, Amendment 1. And do you believe that this proposed rule finalized rule with the possible promises, as we've heard, because it was promised during the debate, it was promised after the debate, it was promised after the rule was made public, but yet the rule has been finalized, and guess what? The promise hasn't come through, but don't worry, we're going to get to it after the election now. So do you believe that this rule does infringe on your religious liberty?
Without a doubt. Yes, this rule infringes upon my religious liberty. I pay approximately close to $1,000 annually into my insurance premium, and it would absolutely violate my religious liberties if that money went to pay for drugs that can have modes of action that can cause abortion, both pre- and post-implantation in the case of Ella.
And Mr. Chairman, as a woman, I believe that this rule, as proposed, violates my religious liberty.